Hello from quarantine. We're going to get started talking about personality disorders to continue what we've been doing in class before spring break. There's going to be, of course, some differences to what we can do via this medium versus what we could have done in the classroom. So I hope you'll just bear with me as we try to scramble through that. One of the biggest things that I think is going to be missing from this experience, unfortunately, is my ability to share previous casework with you. That's just something, of course, I don't really feel comfortable doing as I'm putting these online on the internet. So, some of these things will be a little less colorful because, I won't be able to give you sort of real life examples. I will still link in the description of these videos any videos that I would have shown you in class, things that are already publicly available. So you can take a look at those, and again, unfortunately, we won't be able to look at any of my previous cases or just have me talk about them even, because I think that'd just be a little bit of an invasion of confidentiality, breach, invasion, you know what I mean. So let's get started here, and this first video is just going to be talking about what personality disorders are. As we move forward, I will break up the different personality disorders up into different videos, and then we'll just see how that looks. That is to say, in some cases, I think I'll probably use one video to talk about 2 or 3 of them, and then in other cases I might devote a whole video to just talking about one, depending on how much information I have and how much information is out there about that particular disorder. So, but to get started, we're just going to talk about what personality disorders are. What are we talking about here? So, a personality disorder, the definition out of the DSM, if you're following along, this is on page 645, is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. And so the first thing that I just want to do is break down what that means, what that big definition is. And this definition is similar to the definition that we got when we're looking at mental disorder broadly, right? Because psychology is so complex, this is something we focused on in class because it's got so many different dynamics. The definitions in terms of what we mean when we say a disorder, and in this case a personality disorder, also has to be dynamic and complex because we really have to try to wall in exactly what we're talking about. So let's break down what we mean here by some of these descriptions in the definition. So first, it's an enduring pattern of inner experience and or behavior. So this means that this is going to be something that's going on, of course, inside the mind of the person, but maybe in addition, or perhaps exclusively, is just a behavioral difference that they have, right? And so it might be an inner experience and or it might be some behavioral differences. These inner experiences and these behaviors are culturally deviant. That is to say, they deviate markedly from cultural expectations. So right off the bat, what we're talking about is something that's going to be strange, something that's going to be out of the ordinary, something that's not going to be what we would usually see. But this definition is also allowing for cultural differences, right? That if you get somebody that you're working with that's outside of your culture, that maybe you should make sure to check in with their culture before you try to make something a personality disorder. Again, this particular type of disorder, these particular types of disorder are likely to be confused with cultural differences because of this next piece here is that personality disorders are pervasive and inflexible. I have this sort of capsed and underlined because for me, and I think really for anyone dealing with personality disorders, this is the most important piece. This pervasiveness and this inflexibility. Well, what does that mean? When we say pervasive, we mean that it's kind of soaked in, it's throughout, right? If you take, I use the definition soaked because if you took a sponge and you dunked it in water and you pulled it out, it would be pervaded with water, right? It is filled to the brim. And so when we say that the personality disorder is pervasive, we mean that it fills their life. It is in every aspect of their life. And similarly, it's inflexible. It isn't that you're going to have one person, you're going to have an individual with a personality disorder in one case be, let's just say we're talking about narcissism, be really narcissistic in this particular context, but over here they're really humble, or they're just, not so narcissistic. If it's truly a narcissistic personality disorder, right, we would see that narcissism, those narcissistic traits, be pervasive, right, everywhere in their life, and inflexible, such that you wouldn't see a change depending where they went from place to place, or in context, from context to context. Has an onset in adolescence or early adulthood. We've talked a little bit about this when we were talking about some of the developmental disorders, the reactive attachment disorder in particular, that disconnection. When we talk about the cluster B disorders, I'll tell you what that means here in a bit. When we talk about the cluster B disorders, I'll say a little bit more about that. But here what this is getting at is that this person, this individual, if they truly have a personality disorder, you're going to see this, these characteristics on them at a very early age. And in fact, I actually think that you would see these before adolescence in many cases. You would see these before adolescence or early adulthood, but because once diagnosed with a personality disorder, if it's a truly good diagnosis, then that shouldn't come off of the person's diagnostic chart ever. Again, pervasive and inflexible. This isn't something that's changing about the person. It is who the person is. Their personality is disordered. This isn't something that they've, got temporarily, right? When we talked earlier in the semester about the difference between egosyntonic and ego-dystonic disorders, well, all personality disorders are by their nature egosyntonic. It is who the person is. So, so we might see this onset actually earlier. You might see this in childhood. Again, for instance, looking at maybe an antisocial and a reactive attachment disorder. When does that change over, right? And then even for things like an avoidant personality disorder, say, or a schizotypal personality disorder, we'll talk about those. You probably begin to see some signs of that on a child even. And so the reason, though, that it says early adolescence or adulthood, again, or adolescence or early adulthood, is because that's when we will diagnose it. We're going to wait until, in most cases, 17 before we can even diagnose a personality disorder. Otherwise, you're usually going to note some traits, and again, there are some childhood developmental disorders that maybe look like precursors to some of these disorders here. Okay, similar to pervasive and inflexible, of course, the disorders are stable over time. So again, that idea of them not changing from context to context, they're also not going to change over time, right? So once it's kind of baked in, this early adulthood time, right? Once it's baked in, you don't expect it to change over time. You don't expect it to get better. You don't necessarily even expect it to get worse. Again, it is just the person's personality. So you're going to see this thing be stable over time. And then last, of course, and we see this with all of our mental disorder definitions, is that it causes some distress, significant distress or impairment in important areas in the person's life. So these aren't just going to be somebody that's a little bit out of the ordinary in terms of their personality, but also that aspect of their personality is distressing and or impairing in some way. And you'll remember, similar to the mental disorder personalities, or mental disorder definition, that distress or that impairment may not just be to the individual themselves, it may also be to folks in their life, right? And so if you think about a narcissist, well, I should say that this is probably going to be the case for many, if not most, of the personality disorders because of their egocentric nature, right? Because it is who the person is. It's usually not going to be that distressing to them immediately. Some of the effects may be distressing to them. That is to say, I can't get a job because I'm so avoidant of people that I have a hard time staying at work for too long, right? That type of thing. But the actual personality that itself usually doesn't feel distressing, right? The way that anxiety feels distressing, the way that depression feels distressing. You may lament some of the effects of it, but in other cases, right, if you think again about a narcissist, that person is going to think they're great, they're fine. It's you that's got the problem, and I'm sorry that I'm barking at you, or I'm sorry that I'm taking advantage of you, but you know, and so therein is the distress, right? That taking advantage of it. It's not that the person who's narcissistic necessarily feels distress, it's that they're causing distress, they're causing other people to be impaired. So that's an important piece to note, is that in many cases with the personality disorders, you're going to see that distress or that impairment isn't on the individual. There are some counter examples of that. For instance, a lot of folks, again, who are avoidant do lament that fact, and so there is some personal distress. But in many other cases, a narcissism or an antisocial or a schizotypal, or you know, these type of personalities, you're going to see that maybe the distress is actually happening to or for other people. So one of the interesting things about personality disorders is that they are personality characteristics. That is to say, many of the disorders themselves, or many of the features of the criteria of the disorders, really are just features of an individual personality set, right? Just the different characteristics that an individual could have. I'm telling you this because as we move forward thinking about some of these personality disorders, you are going to notice that a lot of the diagnostic criteria are characteristics that you yourself exhibit, or maybe that you see exhibited, you see others exhibiting. So that's because these are just personality characteristics, right? And I know we haven't talked about them by name yet, but just take for example, here's just a weird visual example that I usually do in class. And so imagine that this is somebody's personality, okay? Imagine this is somebody's personality. Well, what does that mean? Well, this person's personality, if we say that it's made up of the personality disorder characteristics, we could say, well, this person is sometimes a bit narcissistic, right? They can be overly confident, they can think too much of themselves, they can push people around in some context if they think that they're deserving of things. And here's a time when, I don't know, they're a little bit schizoid. Which is to say, they don't really want to be around people. They would rather just be by themselves. They, you know, could care less if people are interested in them, and because they're not interested in people, right? And you feel that way sometimes, and at other times you feel like, I don't know, you're a little OCPD, right? You need things just so, and so you kind of got an order thing going on. You like to have things a certain way, especially around the house, but maybe not other places. And so what I mean to say by this, and this isn't a real kind of personality theory, but I'm trying to demonstrate that a lot of the characteristics that we're going to see in the personality disorders are just real features of an individual, are just real personal characteristics that individuals have from time to time. You have to go back to that idea of pervasive and inflexible, so that you don't, you know, get worried about, oh no, do I have this, or I think my partner or my kid or my kid has this thing. Because what this would look like if this were a true, let's say, narcissist is, and sorry to pick on the narcissist, but they're probably okay with it, is if this were truly a narcissist, this feature of their personality would be way out of sync with the rest of their personality features, right? It's not just that sometimes they can be a little pig-headed, or sometimes they can be a little overconfident. It's pervasive and inflexible and stable over time, and it's such a large aspect of their personality that it's distressing and impairing. So it's important to think about that. It's important to understand that this is what a narcissistic personality disorder would look like. This is just a normal person who's got some of those confident, some of those can-do characteristics. So the personality disorders are split up into 3 different groups, or what we call clusters. Now, these clusters are a bit vestigial. That is to say, they really don't have as much meaning as you might think that they would have, given that they are in the DSM. They did once think that they had this really tight meaning, that they really were tight knit together in this group in some way, in these groups in some way. But anymore, they really have admitted, if you read in the DSM about how they've organized personality disorders, they really do admit that these clusters don't necessarily, what I'll call, hang together so well anymore. They admit that they left them in these clusters just for teaching purposes, which is how we're going to use them, because there is some similarity between each of the disorders in the clusters, but there isn't so much that you should spend a lot of time thinking about it or thinking that they go together in the way that, say, the set of depressive disorders go together, well, where that symptom set is really, really similar, and the different disorders are almost different expressions of those different symptoms, right? Here we're going to have a totally different grouping. It's really more about the feel of the personality disorder than it is anything about the symptom set, though you will see some overlap. One of the other things that I like to point out is that the personality disorders, from my understanding, many of them really came about as a clinical descriptor of clients that clinicians might see. That is to say, they weren't really diagnoses in and of themselves, such that you would have somebody come in because they've got a particular personality disorder. Really, what they were was for the therapist to understand that if you've got somebody with this type of disorder, this type of personality, this is going to get in the way. This is going to be something that you're going to have to work through with regard to any therapy you're giving them for something else. So again, we'll just pick on the narcissist just because that's something that I think some people have some familiarity with. If you're seeing a narcissist and say they're coming in for anxiety, right, there's gonna be some strangeness in the relationship in terms of how that narcissist expects the therapist to treat them, what they expect their therapist to be like. If I'm a narcissist and I'm going to a therapist, you better be the best therapist, otherwise why would I, who am amazing, go see you? Right? And so they're going to be, in some ways maybe judgy of the therapist and those type of things. So this is all just to say that all of these disorders would affect the therapeutic relationship, in addition to, in some cases, being things that may be treated directly, may be being treated directly. About treatment with regard to personality disorders, you may know this, but one of the sort of things that's most well known or most well talked about them is that they don't go away, right? And we talked about that a second ago when we talked about the age of onset. But because they don't go away, that is to say, because they are just a feature of the person's personality, with therapy around these, so if somebody's coming in and they are asking for some help with their personality disorder, the therapy isn't really about reducing symptoms so much. You can do maybe a little bit of that. But really what the therapy is about managing those symptoms, managing that person's life in spite of their personality disorder, right? So again, back to narcissists, if you come in, you're not going to get that person to stop thinking of themselves in the way that they think of themselves. But what you might do is get them to hold back on some of their expression of those feelings. Sorry, I'm getting messages on phones, but you might get them to hold back on some of the expressions of those feelings, right? You might get them not to brag so much. You might not get them, You might get them not to tell people when they think that they're doing something better, right? This type of thing. But again, who they are in terms of what they want to do and what their impulses are, we expect are going to pretty much remain the same. And this would be true for all of them, right? You're not going to significantly reduce the symptoms of the person with this disorder, but what you can do is get them to see it and get them to think about their lives and think about their interactions in a different way, such that they can make some different decisions. Okay, so here are the three clusters. They are lettered, so you've got cluster A, cluster B, and cluster C. Again, there are these kind of descriptors about what each cluster is, but again, they don't necessarily hang together. And sometimes when I'm talking about these in class, I'll say, well, I really think that, this disorder should go in this cluster if they were going to redo them, but, they have just sort of left things where they are. So in cluster A, we have the odd and eccentric disorders. What we're going to see when we talk about cluster A are a set of disorders where people are kind of just weird for the most part. These disorders tend to be ones where the folks are just different in terms of what their interactive style is. That's going to be accepting actually paranoid personality disorder, which is right off the bat one of the ones that I imagine that they'd probably move if they were going to move some disorders out of these clusters. What they're trying to do here in cluster A is think about some type of schizophrenic, some type of near schizophrenic diagnosis. So this was what they were thinking about, and hence the odd and eccentric when they created this cluster. But when we talk about paranoid versus the schizoid and schizotypal personality disorders, I think you'll see that paranoid's a bit different. And again, they're trying to think about that sort of paranoid schizophrenic, that delusional aspect, but it comes off as very different than these other two. So cluster B is the dramatic and erratic cluster. This is the cluster that I think is probably most well known by lay folks. That is to say, these are the disorders that you've probably heard the most about, maybe read the most about, and I think I would admit there's probably the most research about out there as well. So these include antisocial personality, borderline, histrionic, and narcissistic personality. This tends to be thought of as a pretty extreme cluster, and you'll see some extreme examples. I'll link some things for you and when we get to this cluster. Mostly because of antisocial and borderline, and narcissism also gets sort of an extreme rap, but one thing I'll do is I'll talk about kind of what we see as presented as narcissism versus what narcissism tends to really look like clinically. Again, this is called the dramatic and erratic cluster. One of the reasons that this gets a lot of attention is because it's sort of a noisy, if you will, cluster. These disorders tend to make a lot of noise, get in a lot of trouble, cause a lot of drama, right? These type of things. And so this is one of the reasons that folks know about these a lot more than they will some of these others, which really most of these others are pretty quiet, again, excepting maybe paranoid, but we'll talk about that. And then cluster C is the anxious cluster. What they had in mind here with this cluster was that all of these disorders, these folks all experience some type of anxiety with regard to their personality. So this is an interesting thing to talk about given our discussion of most of these disorders being relatively syntonic. But what you'll see is that in some cases the anxiety is experienced when things are out of place, almost literally here for the obsessive compulsive, but it's not that the personality itself is anxious, it's just that they get anxious when, this thing is going to happen or this thing didn't happen or whatever. And so what you see is that anxiety kind of mount, and then maybe they're going to do something about it. Often, though, especially again if we're talking about maybe the obsessive compulsive or maybe even the dependent personality, this is going to be sort of a spurn to action anxiety versus just a felt anxiety, right? They're going to now they have to do something. It's not that I'm just anxious, it's I need to do something about this anxiety. And so again, this does form a sort of personality characteristic, though these for me feel the closest to kind of Axis 1 disorders. Again, they are full-fledged personality disorders, and we'll talk about some of that nearness when we get to these, but they're the ones that do have this kind of flavor of felt dystonic distress, right? That person is experiencing it for themselves rather than just causing it. Okay. All right, so we'll end this video here. When we pick back up, we'll jump right into cluster A, and I think I will at least try to get all of those in one video. I go on a bit about schizoid and schizotypal. They're really, really interesting in ways that are different from some of the cluster B things, which are obviously exciting and interesting in different ways. But so I'll try to fit all of these into one video. If not, then I'll split it up into a couple and present those. But otherwise, so this is what we're going to be doing. I'm going to try to get these out a couple times a week, or drop all of them in 1 week. But for the most part, just follow along. What you're going to need these videos mostly for is to be able to complete this next paper assignment, which is going to be on personality disorders, and then also possibly for your final exam. Okay. All right. Be well, everybody. I'll see you next time. And I don't know. That's all.